we really want to be as honest and clear and concrete as possible. So using the right language is so, so important. I always say to people, if you forget everything else that I've said, just remember to be honest and use simple language and, really provide support and comfort your child or your grandchild as they're grieving. So with the right language, I mean, if the diagnosis is ovarian cancer, that you use the words ovarian cancer, even if it's a 3-year-old child. Because while a 3-year-old child won't know what ovarian cancer means, they'll understand that ovarian cancer is different than a cold or the flu. And for kids, most of the diseases that they know are the chicken pox, colds, flus, and those spread from one person to another. And so kids often worry about cancer being contagious or the illness that mom or grandma has is being contagious. And that's where if you use the right words, you can explain, no, mom has ovarian cancer. You don't catch cancer from somebody else. Daddy had a cold last week. That's different, so you can catch a cold. So this is why we often try, we think we're protecting kids, and so we avoid using the hard words, but really a lot of these words, like cancer or death and dying, are scarier for us as adults than they are for the kids. And kids really pick up how comfortable we are talking about a topic. So we can use, if we use even really hard words when we're talking about things like death and dying, if kids sense we're comfortable about it, they'll be comfortable about it. One thing that a lot of parents really worry about is, what happens if I don't know how to answer my child's questions? Now, that's a realistic concern, because when we're talking about things like cancer or mortality, there's a lot of questions that we do not have the answers for. And that's where it's completely okay to say, I don't know. So often kids will ask me questions, and if it's something medical that I know somebody has the answer to, but I don't, I'll say, you know what, that's an excellent question. I don't know the answer to that, but I bet your mom's doctor does. What do you think if we talk to your mom's doctor, or I talk to your mom's doctor and get that information for you? But sometimes they ask me questions that I know nobody has the answers to. And that's where it's completely okay to say, I don't know, and to just wonder with the child. Quite often kids will say, well, why did my mom get cancer? Why did this happen to my grandma and not somebody else's grandma? And that's where I'll really say, you know what? We don't know. We don't know why some people get cancer and other people don't, especially with something like ovarian cancer. Kids know that smoking can cause lung cancer and things like that, but there's a lot of cancers that we really don't know why people get them. And it's okay to tell that to kids, but we want to let them know that it's not anybody's fault. So I'll answer that question saying, you know what, that's a good question. And that's something I think about a lot too. I don't know why your mom got ovarian cancer, but what I do know is that it's not anybody's fault. I use the word mystery a lot with kids too. That's a word kids really understand. So I'll often say to kids, you know what, some things in life are a mystery. Sometimes people live until they're 88 years old, and sometimes people only live until they're 8 days old. And we don't always know or understand why. That's part of the mystery of life. And I find that that's a really useful word when talking to kids about the things that we don't know, and helping them sort of embrace the mystery and understand that it's okay in life not to always have the answers. It's also really good just to check in with kids frequently and just ask them, you know what, if a kid asks you a question and you answer it, ask them, did I answer the question that you were asking? Can you explain back to me what I've just said to you? Because sometimes I find that kids will ask a question, and I'll interpret it one way, and really the kid was asking a completely different question altogether. So I recently had a little boy who was asking a question actually about his friend, and the friend's mom had just died, and the little boy asked, is he going to get a new mummy? And I interpreted it as, he's asking if his dad's going to get remarried and all of these things. Really, he just wanted to know if when a mummy dies, a new mummy appears all of a sudden. And so once we clarified that, I was able to explain, no, the person who's your mummy will always be your mummy. So even after your mom dies, whether it's when you're a little boy or when you're really a lot older, that person's always your mummy. Your mummy doesn't get replaced. This kid wasn't asking about remarriage or any of these complex things. And that's why it's just really good to recognize that kids will often be asking a question and we may interpret it the wrong way. So it's just good to check in with them. It's also good to really be prepared for repetition. So kids will often ask questions and then they'll go away when they've had enough talking about it, and that's absolutely fine. They might come back 3 days later and ask the exact same questions, and parents feel like, I think we just talked about all of this. Now, when it comes to talking about the illness, again, we want to use the right word. We want to call it ovarian cancer. The more concrete we can make it, the better. So when I'm working with kids, I'll often use some really simple tools, like something like Play-Doh, or I've got a little poster of cancer that I have traveling with me, or a science book where it shows the bloodstream, so I can show how sometimes cancer starts in one place, but it can get into the bloodstream and it can travel to other places. But when I use things like Play-Doh to make little cancer cells and explain how the whole body's made up of cells, and cells grow to make new cells, but sometimes cells keep growing and growing even when they're supposed to stop. And so they can become into a big lump, which is called a tumor. And when I use Play-Doh to do this with kids, it makes it more concrete for them, because cancer is something that's very abstract for kids. So I find if you've got the tools to make it more concrete, and that could be as simple as taking a piece of paper and drawing some cells on it, and then drawing a whole bunch of cells for cancer cells. The more concrete it is, the easier it is for kids to understand, and the easier it is for kids to believe that they're not responsible for it. Because this is something we see in so many kids, them feeling responsible for causing the illness. Often kids will say to me things like, well, even teenagers will say things, I made my mom work so hard. She had to work so hard to take care of me and to provide me with all the things I want, or she cleaned up after me so much I think she got stressed, and the stress could cause cancer. Or I had a little boy recently whose mom had skin cancer, and he said, I liked riding my bike so much, and my mom would often come outside with me, and I'm sure it's my fault that mom got skin cancer. Often, like way more than we realize, kids inside are thinking that maybe they're responsible. And that's why we really want to tell them, even if they haven't shown any signs of feeling responsible, we really want to drive home that the cancer is not their fault. It's not anybody's fault, but it's nothing that they did. We want to tell kids as well that there are treatments that are being tried to get rid of the cancer. Kids need to know that everything possible is being done to try to get rid of the cancer. Even if it's at a point now where there is no more treatment and somebody's receiving palliative care, kids need to know that prior to that, a lot of treatments were tried. If they were, sometimes the case is that the cancer is found at a point where there's so much cancer that there are no treatments for it. And then the kids need to know that. They need to know it's because there was so much cancer there that there's no medicine, there's no chemotherapy that's strong enough to get rid of it. But we need kids to know that if anything could possibly be done, it was done. A lot of kids think that I've had a few kids recently say to me, you know what? If I were really, really rich, if our family had a lot of money, then we'd be able to get better treatment and we'd be able to keep my parent alive, or we'd be able to get rid of this cancer quicker. And so I really remind kids, you know what? In